If we have developed a lean process, but people aren't following it, what can we do to get participation or compliance?
Hi, this is Mark Graban. I think this is a really interesting question. I'm going to go right to the beginning of the question when it says, we have developed a lean process, and ask, who is that we? Is it a manager, a consultant, a senior staff member? I think where people often get tripped up with standardized work is where one person or maybe two people develop a process and say, we've created standardized work, and then they want to just, as we might say, roll that out to everybody in the department. And that's where often people feel rolled over. And if we're forcing standardized work on people, and so when the question asks about how do we get compliance, I really don't like that word in the context of lean and standardized work, because I don't think forced compliance is really the way that we're going to achieve quality in organizations, especially in healthcare. Now, we'll go back to manufacturing even. Taiichi Ohno, one of the fathers of the Toyota production system, wrote in one of his books, this is a direct quote, "Standards should not be forced from above, but rather set by the production workers themselves." So I think this is an idea that especially holds true with highly trained healthcare professionals. And look, this isn't really a matter of level of education. I think this is just a basic respect for people principle within lean. This is one way of showing respect, is by engaging people in creating their own standardized work. So as managers or leaders, if we see people aren't following the standardized work, the first thing we need to do is ask why. Why are they not following it? Is there something wrong with the standardized work? Is it too restrictive? Maybe it's not appropriate for certain situations. In healthcare, standardized work often might be, for example, it's just a high-level plan for the day, of who does what when, roles and responsibilities and timing. There might be room for variation there. We might have to react and adjust based on what's happening. Or standardized work might be a very specific, detailed process, for, say, how we insert a central line or do something, a very specific task. So standardized work doesn't mean we shut off our brains. We often need room for flexibility. This is true with surgical checklists, and it's true in airplane cockpits where surgical checklists are borrowed from as an approach. So I think the best way to get participation and compliance really is to engage people in creating or at least reviewing the standardized work in question. Because people are more likely to follow something they create and something that they're involved in improving. So we need to get people participating. And when it's not practical to have everybody participating, we want to let people have input. And then if it comes down to it, we can use data to help people internalize and understand why it's beneficial to follow the standardized work in a certain way. What's the benefit for patient outcomes or quality or productivity or safety? Either way, we want to get people to want to follow the standardized work. How do we get that internalization rather than thinking about how do we force them to do it from the outside or from above?